everybody. Josh Rubenstein here, the media director for Kaiser Permanente, Southern California, and this is another KP Candid Conversation. So these are conversations that we have with our physicians, our staff, our front line to really find out what's going on and explore some health issues. Really want to talk about these issues and do more than just scratch the surface, dig a little deeper. Today we're talking about diabetes. More than 37 million Americans suffer from the disease, and more than 96 million Americans don't even know they have it. They're pre-diabetic. So we want to learn a little bit more about how to identify diabetes, what is diabetes, get some answers. Joining me is Dr. Ruvdeep Randhawa from our Kaiser Permanente Riverside Medical Center, and you are in pediatric endocrinology, doctor. First of all, thank you very much for joining me for this. How are you doing today? Are you good?
Doing well, thank you. And it's my pleasure to be here.
Excellent, excellent. How did you, what made you want to become a doctor?
Well, so I would take that back to my enjoyment of science and curiosity for nature. But then my dad was a veterinarian. I was able to see him do his job and take care of animals. And I think I just didn't feel the same about taking care of animals, but I felt very much the same about taking care of people, and that's how that evolved.
And taking care of kids in particular.
And taking care of kids especially, for sure.
That's great. So we're talking about diabetes, and it is overwhelming, the number of people who have diabetes, who have pre-diabetes, and I kind of wanted to, first off, kind of do some definitions on what is diabetes. What's the difference between being born with it and developing it? Because there's two ways, correct?
Correct, yes. So diabetes in general, you can think of as a condition where the blood sugar is elevated. That's simply put. And then from there, you try to tease out the cause. And there's generally two types of diabetes, type 1 diabetes and type 2 diabetes. And that is really based on the relationship of insulin production in the body and or lack of that production.
And when we say there are 96 million Americans that have pre-diabetes, what does that mean?
So pre-diabetes is a condition in which the blood sugars are elevated beyond what is considered normal, but not elevated to the point of what we diagnose as actual diabetes type 2. So pre-diabetes is a precursor to type 2 diabetes, where the body has the ability to make insulin, but the pancreas is stressed. The stress is such that typically it's linked to factors where the insulin production has to be increased, and so the pancreas is working harder to do so, and that is linked to the most commonly the risk factor of having excess weight on the body.
Really? So is it possible to be pre-diabetic and not know?
It's certainly possible. In fact, at least in the pediatric population, I would say even 40% of children present asymptomatically. They don't have symptoms. They come in for a physical checkup, and because they have a risk factor such as excess weight, they're checked. And in fact, the blood sugars are found to be in a certain range. If they are in a certain range that's pre-diabetic, that's how that's diagnosed. If it's higher, then of course diabetes type 2 is typically diagnosed.
Well, and if I'm born with it versus developing it, it's still the same condition, right? You're still, the body is doing the same thing?
So basically the difference is related to the production of insulin. So insulin is a hormone made by the pancreas. And the pancreas makes this hormone when it senses we've eaten our food, and the fuel that is being broken down ultimately breaks down to sugar. That sugar travels through the body, gets to our cells, and needs to get inside the cell in order for our cells to make energy. So to make that energy, the cell requires that sugar, and to get the sugar inside that cell, it has to have insulin open the doors to our cells to let the sugar in. In the type of diabetes that you refer to as childhood, typically type diabetes, the pancreas cannot produce insulin. So That is because the immune system has actually gone and destroyed the cells that produce insulin in the pancreas. So without insulin, the doors on those cells can't open, and the fuel, the sugar, can't get in, and it builds up outside in the blood, and you have high blood sugar. In the kind of diabetes that we see later on, typically in adulthood or in our older children, our older youth, we find that the excess weight on the body typically blocks those doors. So the doors can't open the same way. You have insulin, the insulin's ready to open the door, but it can't because it's being blocked. And so again, the fuel can't get inside the cells and it builds up outside, and we have sugar elevation. So the difference really boils down to the reason that the insulin can't do its job. Either it's not there, and that's the childhood type of diabetes where those cells that produce insulin are destroyed, or it's because the insulin that is being made and can be made can't work effectively because of the weight, typically.
Got it. Got it. And if I'm coming in and I don't know that I have diabetes or I'm pre-diabetic, what kind of signs, symptoms are you looking for when you're seeing your patients?
Yeah, so usually when they're referred to the specialist as an endocrinologist, a diabetes physician, they've seen the primary doctor, the primary pediatrician, and they've come in again either with some risk factors such as excess weight on the chart, on the growth chart that's being monitored. They could have family history of type 2 diabetes. There could be maternal gestational diabetes during the pregnancy with the child. That also raises the risk. So there's several things that raise risk. And the pediatrician, as a result, will check the blood sugar. And that's done by a blood draw, a little lab draw, or a finger stick for a blood drop. And if the sugar comes back over a certain level, well, we have a concern. And the symptoms otherwise that can present when that is happening for a while and you have elevated blood sugar going on for a while, the symptoms are typically ones in which you have to get rid of the sugar. So you pee it out, and so you find that you're going to the bathroom frequently, urinating a lot, in particular at night, because normally at night you're not having to get up to go to the bathroom. So if that's happening, that's a new symptom, a typical symptom of diabetes. You might also then find that you have to drink a lot of water to replace that fluid that you're losing and peeing out. So you drink a lot more water. So those are the classic symptoms. As the blood sugars continue to remain elevated, you find that weight loss occurs because the cells are not getting the fuel, not getting the sugar. So they start breaking down your own muscle and fat stores because you need some alternate fuel pathways in order for the cells to survive. That breakdown of your own muscle and fat stores results in weight loss and a byproduct that's usually acid buildup. We call it ketones. And that, of course, makes an individual more tired. They may feel very sick, ill, vomiting. Those sort of symptoms can present. So type 1 diabetes in childhood is typically treated to replace the insulin that they are unable to produce or make. So that involves injections of insulin, which can be done by syringe or pen devices. But nowadays, of course, we have technology like insulin pumps. And there's a lot more to it. There's a lot of, depending on your situation, using glucose meters or continuous glucose monitors to check your blood sugars routinely every day, as well as the need to carbohydrate count. So you know what a level of carbohydrates are in the food that you're eating, so you know how much insulin you require, because that varies depending on that part. So type 1 diabetes is lifelong. It's a chronic condition, and it requires that work lifelong.
So let me just stop you for 1 second. So if I am diagnosed with type 1 diabetes, is that I'm over the threshold? That's it. I'm done. I can't go back. I can't be cured of it.
That's correct. It is something where we don't have the ability to cure it. We can only manage it and treat it. And of course, with current technology, that ability and kids' ability to do this with their family is is something that is very beneficially helpful with that technology, and I think that's a beautiful thing. But yes, there is no cure. There's no reversing type 1 diabetes.
And and I'll let you explain how you do handling type 2 by diabetes. I assume it's similar.
A little different.
Oh, it's different. Okay.
Yeah, so type 2 diabetes is managed primarily based on the fact that there is this excess weight. So that requires, and again, going back, the excess weight leads to a resistance to insulin in the body. So insulin can be produced, the pancreas does it, trying to get the doors on the cells to let the sugar in, but there's a resistance. So to decrease that resistance requires some weight loss because, well, the doors are going to open a lot easier. That, of course, is based on proper nutrition, as well as physical activity. And yes, there are other medications, some that are oral medications. Sometimes we do have to use insulin because extra insulin adds a certain amount to the body to overcome that resistance. But the main difference is it's a nutritional and activity and lifestyle driven management. So we're talking to our families and children about portion control and trying to limit the concentrated sugars and sweets, trying to not have juices and sodas and things with excess sugar. When you want something sweet, go for a fruit. And of course, the physical activity in this day and age is very important because we tend to be more sedentary with our computer and iPad and kids on video games, and so there's a lot of that need there to be more active and limit that non-academic screen time.
And for type 2 diabetes, is that can I be cured of that, or is that also the same situation where once you have it, you have it?
So in pre-diabetes, where it's prior to the type 2 diabetes, that elevation of blood sugar can often be reversed. And that's a wonderful thing. So when we pick up those sugar levels in that certain range, we through intensive lifestyle changes, that can absolutely be reversed. Type 2 diabetes, it sort of depends on how progressed it is. And a lot of the time, strong efforts can reverse the type 2 diabetes. So that's also a positive that we try to focus on and work in that direction.
And as a caregiver, I assume you are thrilled when you can see that reversal.
Yeah, for sure. And we, do this as a team, right? It's a collaboration working with our colleagues who are our dietitian, nutritionists, the RNs who are involved in educating families because it's a chronic condition. It requires ongoing intervention. Our mental health professionals who help at a level of just trying to help encourage the families to work together on this. As well as working with the endocrinologist to manage the medications and just the overall picture. But yeah, it's the best thing in the world to see a child that has that, and then to be able to say, "Hey, you no longer need to come to this clinic anymore."
That's great. And to the other side of that, it's an amazing, an intense emotional toll on a family that has to deal with this, especially type 1, where it is a complete, like the family focuses. I have friends who have kids that deal with this, and I know that it just the constant worry that something's going to happen because it is a very dangerous thing. Correct?
Yeah, and it is because of the fact that if a child, especially our younger children who are less than 5, some are in diapers, they can't, you can't determine whether they're going to the bathroom frequently. They can't verbalize that they're thirsty. So the children who are young, they can often present more severe illness, and sadly, you often find misdiagnoses, and that can lead to death. And that is really tragic and unnecessary because it's really paying attention to some of those non-typical symptoms. So, for example, a young toddler who may be in diapers, When they are undergoing or when diabetes is present, then the blood sugar elevation and the peeing of that blood sugar out results in a pretty significant diaper rash. That diaper rash is not uncommon in babies, but when you treat it, it goes away. In babies who that rash persists, you have to think about diabetes. In a child who comes in with a viral illness, they're complaining of vomiting. A lot of the time, they might not be suspecting, as far as the health professionals might not suspect that it's diabetes, and they're told, well, it looks like a stomach flu. And that's because they're peeing, and when you're peeing, you tend to be hydrated. Well, in diabetes, that's not the case. You're peeing for a different reason. And so whenever you have a young child who presents with a viral illness or even cold-like symptoms, it's pretty easy to check a finger stick to see if their sugar is elevated, and that can save a life. So yes, that's it can be very dangerous.
So the key really is to have really good communication with your primary care physician, your family physician, so that you are all on the same page, and anything that even raises your hair a little bit, you should talk to the doctor about it, right?
I think you want to talk to the doctor and advocate for your child, and as it goes, it takes everybody to a collaboration of our families, our society, and the physicians to work together to make sure that we're providing absolutely the best care. With pandemic, with surges during the winter of infection, the ER, the urgent care, the physicians can be really overwhelmed. So, making sure that as a parent you're advocating, saying, well, have we checked the sugar? My child is young, and I know we think it's a viral illness, but could we check a finger stick? That's very, very helpful, and hopefully the physician does that even prior on their own accord.
In your time practicing, have you seen an increase in type 2 diabetes because of sedentary behavior, and even during the pandemic where people weren't getting out and they were sitting in front of a computer on Zoom classes or playing video games and so forth?
Yeah, absolutely. That is most certainly the case. I've seen that. I know my colleagues have seen an increase in prediabetes quite significantly, as well as type 2 diabetes. Pre-pandemic, we might have seen a tenth of the caseload of prediabetes, and in the years since, with the sedentariness, with being at home, and that comes with its own set of concerns. Children at home often are not able to socialize, interact, walk around campus, talk to friends, and that stress level is not helpful. Boredom, walking into the pantry and eating, of course, that's going to lead to excess weight gain. And the combination of all of these things for our children certainly led to a significant increase in excess weight gain, and that resulted in a much higher prevalence and even incidence in the years of type 2 diabetes. We're seeing some studies that have certainly confirmed that, and I have seen that myself for sure.
And just what's the one thing you'd tell parents when it comes to understanding diabetes right now?
I think the one thing that I think is the most important thing is that we can all work on this to prevent it, and if we prevent, we save an incredible amount of stress and heartache. Certainly from the standpoint of prediabetes and type 2 diabetes. Type 1, there's no preventing that. That is something that if it's there, it's nobody's fault. And I do tell that to my families. It's not because your child ate too many Fruit Loops. It is really something that is genetic in terms of its susceptibility. There may be some environmental triggers we are not aware of as of yet. But for type 2 diabetes, which really started to increase in the 1990s, that was preceded by excess weight gain in our children in the 1980s. And of course, those levels have both been going up, one following the other, type 2 following the elevated weight gain in children. So if we can work towards doing things in our home environments where we're making sure we're getting out and doing it as a family, going for walks or bike rides or Sports are great, and getting out and being more active as a family, as opposed to, being more isolated and watching too much TV, iPad, Netflix, whatever. There's a lot of ways that we take up our time these days. And I think that is the most important thing I can suggest. And nutritionally, yeah, it's eating more vegetables, more legumes, trying to cut down on the juice and soda. That should be a treat. Really thinking about having less of the pantry stuff and more of the fresh fruits. Those are simple things that if we can put out there, our kids will develop the habits. If we continue to talk to them about it, they can develop the habits. But it takes a effort as a society.
Absolutely. Absolutely. The outer edge of the supermarket, not the inner of the supermarket, right?
Correct.
Dr. Happy Randhawa, thank you so much. This is really very, very, very helpful. I really appreciate it.
My pleasure, and I appreciate you taking the time. Thank you very much.
Thank you.